excellent in their presentation and good knowledge about the things.
Thank
Dr.
you so much.
Devendra is and there Dr. Devendra is giving so many talks.
No. Sanjay, we're doing whatever you know we should be doing. No more, no less.
It is wonderful.
It is fantastic, yeah. It's a complementary. Very rare you have wisdom sciences such as yoga and meditation and medicine coming together and
Correct.
giving such a detailed course. Yeah.
Yes. We could not think of this course that it would go to such an high such height, and it would have so many good lectures from doctors and our yoga trainers like you and Anuja, all are contributing a lot. And your yoga sessions are also very wonderful and very informative.
Like, no, it's all the vision that you had.
So our
Ramesh, we can start a chapter. We can start a sorry session. Okay.
That's okay, that happens.
Okay, thank you. Let me you are able to see now, yeah?
Yes.
Rilva, you can make Ramesh Parmar as a side speaker so that he should see in recording.
Yeah, sure, definitely. Let me do that one.
Yes, side speaker.
Okay. Thank you. Let us get started. I know this week has been a diabetes week. You have had a lot of background information, research, different meditation, mudras, postures. So let us dwell a little bit deeper into it. Again, our gratitude to Acharya for having this vision of combining East and West, taking the Eastern knowledge supported by validated, I don't want to say validated, but confirmed by the Western research results so that it's reputable. It can be shown again and again that the efficacy that works. Of course, seek the attention of a medical professional before you do it for yourself or help someone. So just for the uninitiated like me who is not a medical profession, I thought it would help me. It actually helps me to understand a little bit better what is diabetes. I mean, we hear so much about it. Samniji's lecture was fantastic. I saw the presentation. It's such a problem. It's an epidemic, especially India is also going to be like if not already the largest population suffering from this particular chronic metabolic disease, where it's high level of sugar in the blood. And how does it build up in the bloodstream, right? The pancreas produces a hormone called insulin, which is like a key that allows the glucose from the stored glucose in the body to be used for energy. But if the key is not there, then it builds up and resulting in a lot of challenges. Thirst, frequent urination, slow healing if there's any cut, frequent infection, of course, and unexplained weight loss, feeling weak. So you can see this where ramification was very, very severe. Most of the world population suffers from type 2 diabetes, where the body becomes resistant to insulin or doesn't make enough. Type 1 diabetes is common, but it destroys, it's much more severe. It destroys the insulin producing cells in the pancreas. And what helps me is in the context of doing yoga postures, we are talking about kidneys. This is a primarily kidney related disease, talking about pancreas, where the hormone gets produced in the pancreas, so insulin. So where is it? So it helps me to have a different anatomy and have a picture of it to see where it is. So we are familiar with lungs. You've been doing a lot of breathing, pranayam. Familiar with heart, liver on the right side, but just below that liver we have pancreas. Behind the stomach, near the spine. It's not in the front. You can feel the stomach, but you can't feel the pancreas. The average person, I would say, maybe Devendra Bhai or other medical professionals they can press and they can feel it. But that's the where one area where one part of the body where this disease is something we focus on, and the other is here is more detail. It's below the rib cage, right? So rib cage, we can touch it, feel it. Okay, and then go further towards the center, and you can in the back you say, okay, I can feel the area. Maybe that's what I need to focus. Any postures I'm going to do, that's the area of focus. Okay, so that's one part of understanding. Okay, what area I'm going to deal with when I'm doing the posture for this particular disease. And here again, it talks about the kidneys. The kidneys are in the lower back, one on each side of the spine, just below the rib cage. They are in the back, below the rib cage, in the back, one on each side of the spine, left kidney, right kidney. So we know where the pancreas is, we know where the kidney is. Now let us see when we select a posture or select postures, how this is going to help in working with these different organs. Yeah, makes sense. And interrupt me, I may not be medically in this profession, but Vedrba is there and some needs are there to guide in case there's a specific question. Again, a different view of it, of different of the kidneys. We're trying to show that. So we are going to work with different ways, different processes we are going to employ. One is to stimulate pancreas, right? To massage the abdominal organs so that we can improve the insulin sensitivity and reduce any stress. Yoga, so we don't want to create postures, high impact exercises that cause the blood sugar level to rise because already the body is producing enough sugar in the body, extra sugar. So twisting and compressing postures can stimulate the pancreas. So two particular postures, and again this further continues. Half spinal twist, and if you look at it and visualize it how we are doing, and I have diagrams for that. When you're twisted, we are trying to massage the kidneys and the pancreas. Yeah? Something you can do on the chair, on the floor. So such a wonderful posture for massaging, for targeting certain organs, the kidneys and the pancreas. The bow pose, bow Dhanurasana. Dhanurasana is lying on our stomach, and we are lifting both the chest and the legs, creating significant pressure on the abdominal area, and it helps to regenerate these pancreatic cells and improve the digestion. A little bit more challenging, I would say, than let's say Cobra Pose. So these are it's a continuation of different poses to stimulate pancreas, right? Bhujangasana, Cobra Pose. What we are trying to do is again, it stimulates, it massages the pancreas, and that in turn stimulates the production and secretion of the hormone insulin. So Bhujangasana, we have the variation again depending on our where we are in the yogic practices. You could do it on the palms or put your lower arms. So there are different you can modify it based on the individual that you're working with. This is the new pose. I'm not sure if you guys have done the frog pose. It's very effective. It directly stimulates the pancreas. And what we do is we go ahead and sit in Vajrasana and take the thumbs inside both our palms, make a fist, press it near the belly button, and then lean forward. So you're already in Vajrasana, your back is vertical, then you lean forward. I have a diagram, I'll show you. I'm not sure if you have, I have not covered, maybe somebody else has covered frog pose, which is fantastic for stimulation of pancreas. And of course, triangle pose, Trikonasana. When we are trying to bend on one side, we are compressing and stretching the other side. Let's say I'm bending on the right side, I'm going to be compressing on the right side and stretching on the left side, right? Again, that stimulates the pancreas and the liver, encouraging better flow, blood flow, and improving the efficiency of insulin secretion. So, so just in the category of stimulating pancreas, you're familiar with these poses: the half spinal twist, the bow pose, the cobra, the frog, and the triangle. Okay, and I have diagrams for each of these. You're probably very familiar with all these poses, but let's just continue here. For insulin sensitivity to go ahead without additional without creating absorb more glucose effectively without creating additional insulin. So sun salutation improves circulation, it boosts metabolism, and again, it is this done in the morning. Let's say 6 rounds or 12 rounds. Here it says 5 or 10, doesn't matter. Helps to stabilize the blood sugar level for the day, right? Can you imagine starting a day with sun salutation on a regular basis, whether you're healthy or you're doing it for diabetes? Your body has already gotten such a big stretch, such a nice stretch. All parts of the body are stretched, right? So this is a fantastic panacea, I would say, sun salutation. Of course, Tadasana. So basically, large muscle groups are involved in this, calves, thighs, glutes, core, and these burn a lot of glucose, so that gets used up, lowering the blood sugar level in the body. Can you imagine that? When we do the Tadasana, we focus on postures. Okay, how do I do it? I tighten my core, tighten my quads, my legs, and stretch. Now, what is it doing now? Oh, it needs so much energy, so it's using up the stored energy, thereby bringing the lowering the blood sugar level. Such a fantastic uh, understanding of what these poses are doing uh, in the body. Um, Seated forward bend, of course, Paschimottanasana, uh, helps the body because we are compressing the abdominal area. It processes sugar more efficiently and calms the nervous system. Anytime we are bringing the heart down, uh, it's definitely a calming where parasympathetic nervous system kicks in. And then a couple of additional poses. I don't remember whether they did warrior poses, but warrior 1, 2, 3. But we start with 1 because large muscles are getting involved. Again, they are the largest consumers, as we saw in the earlier in the Tadasana. Here, similar also. So your quads, your legs, all are large muscles and core, and they consume a lot of energy, a lot of sugar stored in the body, so that helps also. And Pavan Muktasana. It When you bend the legs, again press it against the chest, they apply direct pressure to pancreas and the other endocrine glands in that area. It stimulates the organs and improves the blood circulation in the area, which can help regulate insulin secretion. There's so much is happening whenever we are doing certain pose, anatomically, physiologically, just amazing how it's affecting, how it's improving. There are people I've seen who do yoga poses at age 90 as a sitting forward bend where the nose is touching. I'm saying, how are you able to do it? It's helping them maintaining good health, helping them also keep stretching helps, but also maintains. It's not only just stretching, but also maintaining good health as well. I mean, this is definitely a very different perspective. Typically, when we do these courses, yoga, we go for yoga class. Okay, I want to feel good. I want to feel stress. I want to stretch the body. I want to strengthen certain area. But for longevity, for better life, the yoga postures are so good. And this is a new perspective, which I hope you would appreciate that. Yoga is just not for physical exercise, but it's for complete well-being and leading a better, longer life. The restorative poses, so we covered the pancreas, we covered the insulin part. Now, we don't want the body to get too hot. So we are looking for restorative poses such as Viparita Karni. It lowers the blood pressure and induces deep relaxation because the legs are up. And so the heart doesn't have to work that hard to push the blood towards that. Because it's by gravity itself, it automatically is much easier. The load on the heart reduces. Of course, child pose, it reduces the production of cortisol, the stress-producing hormone. When we are stressed, the sugar spikes in the body. Again, already there's the excess sugar content. This further is harmful. So child pose is fantastic for this particular ailment, for diabetes. And Savasana, after we have done all these postures, the Savasana helps for the body to absorb the metabolic benefits of this practice, right? So the corpse pose. So again, there are variations of the spinal twist. We have seen this before. You can do it on the chair, on the floor, with the leg, with the hand outside the leg, or hands behind the back. The diagram on the left is easier if somebody is not initiated into this and you want to gently bring them into it. Perhaps starting on chair is good. And if they're able to sit on the floor, then doing the one on the left side is a good progression. And then, of course, the diagram on the right side, using the hands to create a counter motion where your torso is getting stretched, and your legs are also getting stretched using the arms for the lower arm. This is the bow pose. And look at it. This is a very you see her hips are on the ground, but for this extreme flexibility is required. I think in cases where just the abdominal area we're trying to massage, so you go ahead and grab hold of the ankles and create an opposite motion. Move the legs away from your hands. So that automatically will bring your upper body higher, and of course lower body. And then you try to rock. You see what I'm saying? Let me just demonstrate it just to understand. You might have eaten just now, but I want to just show you the counterbalance, how this helps. My chin on the ground, grabbing hold of both the ankles. Actually, forehead should be on the ground, but since I'm wearing glasses, I'm putting my chin. Then I use my core strength to lift my body up, push the legs away. So now my stomach is still on the ground. Idea is to massage it. Then I create a rocking motion. So massaging the whole middle part of the body, the pancreas, the stomach, the abdominal area. Right? I don't need to be that high. My stomach isn't, like this diagram, what you're seeing, it doesn't need to be that hard. Idea is we want to massage the abdominal area. If you're flexible enough and you can do this, fantastic. But if you say, hey, my abdominal, not that flexible, but the key is you bring up to the rib cage. If that area is up, so now the abdominal is getting squished on the ground. Now you're massaging the organs because of the pressure that you have, and then you're rocking back and forth. Of course, Bhujangasana, you're very familiar with it. This is Mandukasana, the frog pose. There were different variations of the frog pose. I selected this because it's easy to do it and understand it. So we take the thumb inside the palm, make fist with both the hands. I'm in Vajrasana, and I press it against near the belly button and press it, and I can spread the leg a little bit and then come down. Child pose, and keep coming down. I can spread a little bit more and bring the forehead to the ground. So you're creating a pressure in that area, in the abdominal area. That's frog Mandukasana. The triangle pose, you're stretching on one side of the body, other side is squeezing the internal organs inside. So this is the compress and stretch, and that creates the massaging effect also. Of course, you are very familiar with this sun salutation, and because we have Cobra in this as well. So it's a strengthening, stretching exercise. Yeah. Dhanurasana, we have done and practiced this because we are engaging large muscles which require a lot of energy. So engaging these muscles helps reduce the excess sugar in the body. Such a simple pose, I think this has got such a great amount of benefit. Of course, seated forward bend, your abdominal area is getting squeezed, so you're massaging it, squeezing it. Again, you don't need not be touching the toes. It's wherever you are. The idea is do it on a regular basis. Your body becomes more flexible, so the torso will come closer to the legs. Virabhadrasana, Warrior 1. This sequence of Warrior 1, 2, and 3. Let us just focus, because again here we are using the large muscles, so the stored up energy gets used up, right? So let's say I take the left leg forward, right leg is in the back, and then I'm just I can lift my heel up and then bend my left leg. Here again, this is again, the idea is that a lot of energy is required. Your quads is engaged, core is engaged, and consuming a lot of energy. A lot of energy demand is produced in the body, placed on the body, so the sugar stored gets used up. Okay. Now, from this, I can go ahead and do the Warrior 2. Since my left leg is stretched out, I'm looking over to my left hand. Both the hands are parallel, shoulder level. That requires energy. Engaging both the legs, bending the leg requires energy, and looking over to the left finger. Then I can migrate. Let me come off the mat. Then I can migrate. I lean forward, left, one second. Lean forward, and then tighten my core. I can keep my right hand in the back and keep lifting the right leg. Or I could maintain a prayer pose. The lifting leg has to be parallel to the ground. So you can do the sequence. You get the idea. We are trying to engage the large muscle groups so that stored energy can be used. So depending on the person, you can start with warrior one. If you get comfortable, if they're strong enough, go to warrior two, add warrior three if they are balanced. But I suggest stick with warrior one, get it used. Idea is to use up the stored energy. Any questions, comments, don't hesitate to interrupt me. I'm going back and forth between the presentation and the demonstration. Pavan Muktasan. We have done this. You can do one leg at a time. Start with, then bend both the legs. The head can be on the ground. If required, they depend on the flexibility. You can head be on the ground, or you can lift it and have the nose touch the knee, or the knees, depending on the one leg or two legs. And okay, I think that's good. I was thinking whether we are going to rock back and forth to further intensify the massage on the back side, right? See, this is front side massaging as well. So if I want to produce a little bit more intensified effect, right? I did this, interlace my fingers, and now my head is off the ground. No, I can try to rock back and forth. So I'm massaging the back side and squeezing the front side. Look at it. The kidneys are getting massaged while I'm rocking, and the front part of the body, because the knees are bent, creating a squeeze and massaging effect. So simple pose, right? Very beneficial for massaging the internal organs. Again here, Viparit Karni. You can do legs up the wall, or you do it away from the wall. Key is, if you're doing legs up the wall, your back can be fully on the ground. If you're doing without the wall, you can do the same thing. Back is fully on the ground, legs are up. Feel more comfortable, go ahead and raise your torso 45 degrees away from the ground, that angle. And support your back. Of course, we are familiar, right? Very familiar with this. The idea is the heart is lower, very relaxing, reduces the cortisol in the body, the stress hormone, down regulates. And you can do this. You may say, hey, my bottom is not touching the heel. You may start with that. But if you stay in the posture 1, 2, 3 minutes, the gravity will pull you down. So your bottom will start touching the heel. If that doesn't work, don't worry about it. You can put a pillow between your bottom and the heel and start with it and slowly keep removing that. Slowly keep removing the pillow, and then it would stretch as well. I have always said this is one of the hardest pose because this is a great pose to live in the present moment, right? Your mind must be racing, but when you do the pose, you let the body be completely limb, and with the culture to autosuggestion and relax the whole body. When you are not moving, the motor nerves then are quiet, silent, and with the autosuggestion, the uh, mind also slowly calms down as well. This is an important slide when you work with people who are suffering from this particular ailment. Physical activity can cause the blood sugar to drop, hypoglycemia. So at that point, you may want to make sure something handy, juice or a glucose tablet nearby. Watch for neuropathy. So be very careful. Somebody who's been suffering, they may not have enough balance. So for that, use a wall or a chair for certain postures. Where you're doing a warrior, for example, or you can do a Dhanurasana with the wall. Right? Your back is facing the wall, for example. So you're supporting, your back is supported with the wall. So that's also fine. The idea is to not, to prevent any injury. Then when you're doing, let's say, Virabhadrasana, you can use the back of the wall or support, use the chair. So that you have access to a chair if something happens. But wall may seem like a better idea where your back is facing the wall so that your back is also resting. So all the standing poses, people, want to be careful that they don't lose balance or fall down. Avoid the heart yoga poses, right? So that's why we are doing respiratory yoga, not like heart yoga or Bikram yoga. Definitely no for folks with diabetes. No Bikram yoga, no heart yoga. Then this is very, very important. This is the it increases the eye pressure if you're doing any full inversion. So that's why we're doing Viparit Karni with the wall support, or on its own, but not fully coming vertical, not like a candle pose, right? Not a shoulder stand. So you have to be diabetic eye disease. You have to be very, very careful about that. So these are some of the safety tips that you have to be careful when you're working with patients. So this is just summarizing it. Half spinal twist massages the kidneys and pancreas. The bow, Dhanurasana, it regenerates the pancreas and improves digestion. Right? You are rocking, right? Or even if you're not rocking, you're just massaging. So it just improves the digestion. Cobra, it massages the pancreas and stimulates the production and secretion of hormone, insulin. Bhujangasana and triangle, similar. The pancreas are stimulated. Then salutation, as you said, it boosts the metabolism so that blood sugar can be stabilized throughout the day. And if you take mountain pose and warrior pose, for example, they have a huge demand. The muscles, large muscle groups are used, huge demand on the body, so the sugar gets consumed. So bringing the sugar level down. Seated forward bend, blood sugar processed more efficiently because you're squeezing and stimulating the organ. When relieving, insulation secretion is regulated. Viparit Karni and It induces deep relaxation, lowers BP. Child pose, again, we are getting parasympathetic nervous system get a lot more activated by doing these restorative poses. Legs up the wall, child pose, corpse pose. All these are good in reducing cortisol, giving a break to the heart so that BP gets lower, and avoiding any sugar spikes due to stress. So this, I just wanted to have this slide so you give a pretty good picture of different categories of postures, right? Certain set of postures would be pancreas, certain set for reducing the blood sugar, and the certain set is for relaxation, reducing the cortisol level. Okay, I think I'm reaching the end of this presentation. If you have any specific question, let me know. Any particular demonstration or any particular question that you may have. And we are going to focus on asana tomorrow. We'll do other postures, but also make sure we cover all the postures related to asana. We do it together, practice it together. Right? Here, I'm just discussing the postures for diabetes. So in these sessions over the weeks, we will do all these postures together. Being that this is after dinner, I'm not sure. It may not be the right time to do it, but we can do it together in the Saturday class. Any comments, questions, Pandami, Devendra, anybody?
No, I think this is awesome, and I think it your emphasis on the big muscle group and how to think about it is, I think, very helpful, because I think it gives us, like, if you have a logical mind to tell why we're doing it, then we'll remember it better also. So I like that explanation, because we'll then remember which poses for why they work. Yeah, I think it's really helpful. Appreciate that.
Good. And that's why I put the physiology diagram. So it helps. Okay, where is the organ? If you're not in medical profession, I can't see it. Where is my pancreas? Where is my kidney? So now once I have the diagram, then I can say, okay, what postures I can work on, or when I'm doing a specific posture, I have to focus on that part of the organ, that part of the body, that organ. And that helps. And why am I doing it? So that helps also. You're right. Once you know the reason, and then you can improvise. You may say, okay, fine, I did with Virabhadrasana Warrior 1, maybe I can do with Warrior 2, for example, because it's large muscles getting used up. Sorry, somebody had a question?
No, I was just saying it's a perfect flow from showing the location of organ to the asanas, then reasons behind it, and the summary page. So
yeah. So that's how I learn it, right? I mean, we are not in this profession, so we don't, we are handicapped compared to Devendra Bhai and others. I'm handicapped, so how do I capture that? I can never capture, but at least for this purpose of learning the proper asana and why it works, it helps in visualizing how my internal organs look like. Yes, Rakesh Bhai.
Yeah, Ramesh Bhai. I was just thinking that suppose we have a class and there are people in the class who have diabetes, right? What questions should we ask them so that, just saying that certain poses may not be done for people who have diabetes, but specifically what type of questions should we ask and make them stay away? You shouldn't be doing this pose.
Very good question. Very good question, because if you're talking about general class and somebody has got diabetes, definitely you don't want to increase the stress level.
Right.
no headstand or no shoulder stand.
Okay.
So solicit feedback. If you have any specific ailment, let
Mhm.
me know so that we can recommend a alternate posture or do the savasana. At the end of the day, if the alternate posture doesn't work, savasana or a child pose. You can't go wrong with these two.
Those two are the
But
same.
go ahead, Rakesh bhai.
Balasana and Shavasana are the safest. Everybody can do that.
Everybody can do it. If they can't sit on the ground, then savasana on the chair is perfect.
Yeah.
Some people may have difficulty sitting on the ground. Okay, fine.
Yeah.
Do a chair pose. I think I demonstrated it. So basically, your back is inclined, your body is straight, like you're sitting in a plane, right? And you're relaxing.
Yeah.
So every posture, there's always one posture everybody can do.
Yeah. And
But it's better to be straightforward. If you
Right.
have any physical ailment, any limitations, this is not a competition. So
Yeah.
tell me so that I will advise you properly. Certain postures may not be recommended for you.
Right. Yeah. So are there asanas, like people will not know, right? People who have diabetes will not know which asana would be harmful for them, right? If they're not familiar with yoga, right?
Right.
Are there asanas in here and on the asanas that we covered today that they specifically should not do?
That's why I had the precaution slide. If you look instead of a specific asana,
Yeah.
look at
So
look at the thing, right? I
yeah,
don't want to
but
create heat in the body.
right, we
I
didn't
don't want.
the asanas here.
There are no asanas here. You're talking, yeah. You're saying.
Yeah.
Okay, let's take the retinopathy warning. Right? Anything that increases the eye pressure.
Yeah.
If the blood is going to rush,
To the
I'm doing a shoulder stand.
Yeah.
If I'm doing a headstand, blood is going to rush. It's something you can say, okay, I'm going to avoid that. I don't want to recommend that for diabetes.
Okay.
Or
what I was
it's
looking
going to create, So you have to be aware what each posture is doing physiologically as well, right? Okay, hey, my balance is not good. Okay, then always have the support. Okay, what balance, what postures? Any posture that requires standing on leg, both the legs, single leg, or taking one leg off the ground. Okay, try to avoid those, right? So there's a category of asanas, but if you know from a big category wise, balancing, the retina pressure, hot yoga. So from these general categories, you can say, okay, this particular posture may involve these different parts of the body. So I don't think it's appropriate, or I think it's appropriate. You see what I'm saying? That's why I'm trying to share it and categorize it. So you have an idea and a correct idea that, okay, this is good, or this is not good for somebody who's suffering with diabetes.
Yeah. So I mean, just thought came to mind is, should we add another column to your table of benefits? This table here, another column to the right, listing some conditions that should not be attempted if you have these conditions.
It's a good idea. Let's take the half spinal twist. The top of my head, why you couldn't do it? Unless you have had, again, this is a dialogue. If somebody has any ideas, let me know. Okay, what could be a restriction? Why somebody can't practice this? If they have had some surgery, for example, in the torso area, chest area.
Surgery is a general for yoga, all yoga, right? All yoga asanas. If somebody has had surgery, that's a caution right away.
It's a caution. But if I'm doing let's say somebody has had a heart surgery, the half spinal twist is definitely a no-no. Because you're trying to work with the upper part of the body, and
Yeah.
that's just no, right? Very sensitive area.
Yeah.
Leave it to the person how old the surgery is, right? For example.
Yeah.
Yeah. Any other? Thank you. Any other comments, questions?
So many exercise. So it is good, and they are very simple. I think everybody can do that, but just those who are in some old age might be some of the exercise they cannot do. But walking on the toes and even on seating the chair, they can raise their what we say their heels up and keep them again on the ground. In this way, they can do this kind of exercise. That is also beneficial for the diabetes.
Yeah.
Yeah. That can be done easily by anybody. Yes, you have given wonderful informations and all the exercises, which are very useful for controlling the diabetes problem. And it was very good presentation.
Thank you. Ravindra Bhai, anything you want to add from there?
No, I totally agree. I think
Medical.
Ramesh, Rakesh is a good point that, sometimes just for exam and memorizing and visualizing, some tools can help. So I think the principle is good to learn, which is correct upside down, then not good for the eyes. We already did for glaucoma, right? So we said anything upside down, even standing forward bend, you won't do anything. Even the dog, we won't do because some. So I think, but what we could do probably at some point is list them as we could list here, but we just list the poses where we couldn't use them. Maybe better than here. Like he'll be confused, but if we just had someone list all the poses where we would think they wouldn't make sense, that's a better to learn. The poses limits are better to learn than per disease, I think. So to your point, I think we should do that. And we kind of do that a little bit like when not to do it when we talk about side effects of everything, or what's good and what's bad for. So in that pattern, we can say this pose is good for this, but not for this. That's a better place to have it than per disease, I think. Otherwise, it'll get too confusing. But this way, you'll have a list per pose that you may want to say, in this situation, be careful. And then the flip side is that when you start very easy, right? You're not going to do the hard poses right away. So I think that you can have a dialogue with your patient or your client that, look, I can show you simple ones. Go double check with your doctor, make sure this is all correct because I don't know your disease and you may not know it. And that's not a cap. It's a good thing, right? They can double check with the physician and see what they do. So sometimes they had blood pressure, but the physician didn't care. Go do anything you want because her blood pressure is well controlled, right? So the label blood pressure is there, but she's so chronic, long-term, well controlled that the physician says okay to do those poses that we normally say be careful because for her treatment's so good, he sees no risk. So you can always have a dialogue that go check with your doctor because you don't know and the patient doesn't know. So that's okay. They know what they're trying to do and describe it. Not all doctors would know, but at least you've got some safety net there. And the final thing often is, and I don't know, Ramesh will maybe more able to tell you, but when you do yoga with somebody who's sincere, they'll find what works for them. They will realize this works my body, not this. And in kids, I do that in my course in kids when I teach them for belly pain in my clinic. I show them like the 15 things and breathing and all that in whatever age, right? But then after third visit, I sit with them and say, okay, what do you want to do in the morning? What do you want in the evening? And they pick. And they pick what they like. And, pretty much, I don't think it matters. I think it matters. And I might pick one for them that I think is specifically good for their disease in case they missed it. But now they own it. They know they tried it. They liked it. They felt good about it, right? And they're more likely to do it. So I feel sometimes we don't have to do all of it, right? I think even if you take 2 of these, you'll be fine. I really do. I think only 2 will be fine. You just have to get them to do what works in their life, So anyway, that's what I do.
We have multiple poses for each of the different ailments. So depending on the interest, depending on the ability, of course, it means selected. I like the idea. If there are 5 poses and somebody is more inclined to do one, they will take the ownership and they'll do it more often, more regularly, without being reminded by the physician or parents at home.
Yeah, good idea. I like it.
Good. Well, that's all I had. So tomorrow we'll have a session with Dami. Right. You are muted, I think. Dami, we can't hear you.
Okay. My voice is clear now?
Yes.
Okay. So what should I say? Do you have some question?
Now, tomorrow we'll continue with the practice in the morning
Yes.
after the 9 o'clock session is over, 9:30. We can continue with the yoga, 9 o'clock from the meditation, correct? Yeah.
So tomorrow I have to cover one topic. So it may be that you can start with 9:45. Is it okay?
Yeah.
45 minutes we can divide into. So first I will take my lecture and then your session will start.
Good.
So
And then we have to cover the asthma poses also. I think I may have sent that presentation, might help. If not, I'll send it to you on the research behind asthma, lung disease.
Yeah.
So now meditation. All are ready for meditation. So who is going to give the session today? It is Sheeta.
Vandami, I'm sorry, I wouldn't be able to do it today. I was.
Okay. So Suril and any other? Devendra Bhai or Devendra Bhai is already a
Sorry,
speaker
yeah, I'm on
in
call today, so I'm
many
just on a
sessions.
call
Yeah,
with
in
the
many
hospital,
sessions.
so
Yes.
maybe not today for me.
Okay, so today I can give my session. And Narendraji, are you ready?
I can try one color prediction.
Anupreksha?
Yeah.
Okay. Which Anupreksha?
No, the color.
Color. So that is
color.
Okay, color meditation.
Mm.
Okay, so you can start.
Yeah.
Today or tomorrow?
So first,
yes,
I can do it now. I'll try what
okay.
my best ability.
Yeah, it is true.
Take a comfortable position, whether you're like Sinasana or Padmasana or Lotus, or you can sit on the chair. Keep your body relaxed. Your back and neck and head are in straight in one line. Gently close your eyes. We'll chant the mantra Om mantra 5 times. Breathe in and breathe out slowly first. We'll start with Om. 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 Breathe in. Om. Om. we are practicing Preksha meditation for the psychic. I'm practicing Preksha meditation for psychic. Keep your body relaxed. Now we start with right toe. Your suggestion to keep right toe relax, relax, relax. Then we move to the feet and the ankle, and then calf muscles, knee and thigh and hip joints. Your suggestion to relax, to relax. Now we concentrate on the left toe. Ask to relax, to relax. Then we do feet and ankle and calf muscles, knee joints and thigh and hip muscles up to relax. So just all the lower part of the body is relaxing. They are relaxed. Then we move to middle part of the body. So liver, pancreas, kidney, stomach, long intestine, short intestine are relaxing. As we move upwards, lungs and heart and chest are relaxing. Suggestion to relax, to relax. Then we move to the neck and vocal cord to relax, to relax. Then a right thumb and the fingers and the palm, lower arm, upper arm, and the shoulder to relax. Your suggestion to relax. Then we ask left thumb and the fingers and the palm to relax, to relax. Then lower arm and upper arm and elbow and the shoulder to relax, to relax. Then you goes to upper part of the body, face, cheek, mouth, nose, ear, eyes to relax. And as we relax, the energy flow from bottom to top and top to bottom. So third part, we concentrate on the energy flowing from the bottom part of the bone towards the top of the head. As the energy goes up towards the head, and the negative energies as we breathe out goes downwards. Now we concentrate on the color. concentrate on the green color on lower abdomen. See, the more green color molecules are surrounding the body and gradually going inside your body. And now think of the blue color, peacock blue in the center of your throat. And is surrounded by the blue color. The body is surrounded by the blue molecules. Now you concentrate between two eyebrows at Darshan Kendra with the white light. And the white light is surrounding all your body and going into your body as well. Sorry, it was supposed to be orange-red color, the sunrise color between the two eyes. So concentrate on between the two eyes. It's orange-yellow color. Then concentrate on the center of your forehead with yellow color, the sunrise color. Now concentrate white color on the top of the head, the Gyan Kendra. Now take two long breath and gradually release the air. Now we chant Om Mantra 3 times. Om. 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 Now rub your palm and put it on the, keep your eyes closed and put the palm on your eyes and gradually blink the eyes 3 times. Then move the hand downward and open the eye. Om Haram.
Thank you, Narendra ji.
made lots of mistakes.
Yes, you were not following the text, is it?
No, I've
So
done proper
yeah,
preparation and made some.
you all have to have this copy with you whenever you have to give some such kind of
Okay.
guided session. Okay,
Vandami
so you
yeah.
can see the instructions step by step from the textbook. It is not necessary that everything is in your mind, but you can
Okay.
follow the right text from the
Yeah.
mapper.
Okay, Vandami.
So it would be
Yeah.
good. So people will be benefited by right process. Okay, it is
Okay, thank you.
purification of psyche. We
Yeah.
are practicing praksha meditation for the purification of
Thank you.
psyche. So in this way, and there are certain steps which we have to follow one after another
Okay,
to give the session.
I did see the colors though somehow. I saw the green and the blue, so I don't know, but it
Wow.
worked. It's really good.
Yeah, it is good. Yeah. He's a very simple-hearted person, so whatever he will speak, it will come out of his heart.
Yeah.
That
Yeah.
is right.
And that affects.
Yep. True. Thank you so
Vandami
much.
Yes. Thank you very much. Okay, so tomorrow we have session in the morning at 9 a.m. So 9 to 9:45, there will be lecture, which was not covered in last week. And this week especially, yes, in the last week or in this week.
Monday, I think. No,
Last week's.
last
Yes, last week. So I will focus on that, and then there will be yoga session. And if you have any queries regarding any topics, you can ask any question. The experts, Dr. Devendra would always be there, and Ramesh Parmar would be there, and
Yeah.
I would be there. Okay.
Okay.
So thank you very much.